Senator Pavley, the floor is yours.
Thank you very much, members and Mr. Chair. I'm delighted to have three co-sponsors for this measure: Planned Parenthood Affiliates of California, the California Family Health Council, and NARAL, Pro-Choice America. SB 999 is an important bill to provide greater access to birth control and reduce the rates of unintended pregnancy in our state simply by changing the timing of contraception dispensing. As you know, right now, many women have to go to the pharmacist or go back to the doctor every 30, 90 days to get an update on their prescription. And it's all about consistency when it comes to birth control in order not to have unintended pregnancies. There is a need for consistent, uninterrupted contraception. Senate Bill 999 requires health insurers and health care service plans to cover up to 12 months. I want to stress that, up to 12 months of FDA-approved self-administered hormonal contraceptives at one time. That means it could be less, but up to 12 months. This dispensing will be allowed under a healthcare provider's prescription or courtesy of a bill that was authored by Senator Hernandez, SB 493. It'll sound familiar, hopefully, to you. That was signed into law 2 years ago, Ed? Yep. That allows pharmacists to dispense contraception without a prescription. So this bill would allow pharmacists, under the protocols being developed by the State Board of Pharmacy, this would also apply to them as well as traditional healthcare providers. I wish to note that this measure has a lot of support in my district. I was contacted by over 200 women that live in LA and Ventura counties, and I think it was because a year ago last June, Oregon enacted the first law to provide 12-month dispensing options in the nation, and my constituents requested a similar benefit. And this is particularly true to people that live in rural areas or work schedules don't allow you 30, 90 days to keep renewing your contraceptive prescription. Since that time, however, since Oregon passed the bill, the District of Columbia has enacted the same law. And this year, the states of Hawaii, Washington, Wisconsin, New York, and Colorado have joined California in introducing similar legislation. The benefits of annual dispensing are nationally recognized and recommended by the Centers for Disease Control and the American Congress of Obstetricians and Gynecologists. By reducing unintended pregnancies, it's been shown that cutting down on medical visits and annual dispensing under SB 999 would save employers and consumers up to $42 million a year. The idea of annual dispensing is not new to our state. I wanted to give you three examples, so this is not, to me, it's a technical cleanup and allowing less, up to 12 months, but this is not a new concept for our state. Our Family PAC program for low-income women has been successfully providing it for over 2 decades. Also, Medi-Cal fee-for-service programs has been providing it for several years. And finally, on February of this year, it is now required of all managed care plans in the state. So this is a bill as time has come. I have with me 3 witnesses today I'd like you to listen to for just a few moments. Christina Romero, if you would start off.
Sure. Christina Romero, legislative advocate for Planned Parenthood Affiliates of California. We represent over 115 clinics across the state. And I want to share with you SB 999 requires plans to cover a year's supply of birth control dispensed at one time. The bill does not vary based on what kind of plan a woman is on or who covers her insurance, whether it's Medi-Cal managed care or a private insurer. The bill provides access to all women. Currently, and for the last 2 decades, as the senator noted, FPAC has covered up to 13 packs of birth control at one time, and just recently Medi-Cal managed care has also moved to providing a year's supply of birth control for women at one time, which is hormonal contraceptives. In the last year, Oregon and the District of Columbia have passed similar laws. And right now, Alaska, New York, Rhode Island, Washington, Hawaii, and Wisconsin are all considering similar legislation. In Washington, they expect an annual savings of $2 million per year. And CHBRP analyzed this bill and expects cost savings of $42 million in California per year. Additionally, the bill is not a mandate or an expansion of coverage. SB 999 alters the timing of an existing covered benefit for FDA-approved contraceptives. This bill does not exceed essential health benefits under state or federal law. And not to our surprise, in Oregon, after the law was passed, they have not shown a significant amount of wasted pills. Further, a recent review of SB 999 by the California Health Benefits Review Program, CHBRP, shows that dispensing a 12-month supply of birth control at one time, one, reduces a woman's odds of having unintended pregnancy by 30%. It reduces unintended pregnancies in California overall annually by 15,000, and reduces or decreases a woman's odds of an abortion by 46%. Senators, all women, regardless of her insurance coverage, should have access to best practices when it comes to contraception and the ability to reduce unintended pregnancies. SB 999 puts control in the physician's hands by allowing the physician, and rather than the insurer, to prescribe whatever supply of birth control they deem appropriate for the patient, not to exceed a 12-month supply. Similar to Senator Pavley, Planned Parenthood is committed to working with potential opposition and concerned parties on the bill, just as we're committed to the men and women we serve daily in healthcare centers. I ask for your aye vote.
Thank you, Ms. Romero. Others in support, and thank you for the entrance, Senator Block. Yes. Good afternoon.
Hi, good afternoon. I'm Dr. Mitchell Crennan. I am a professor and chief of family planning in the Department of Obstetrics and Gynecology at UC Davis. Although I'm a physician at UC Davis and have been a health professional practicing in this area with expertise for 24 years, the testimony and expert opinion I'm providing represent my personal and professional opinions and don't reflect the official position of either UC Davis or the University of California. Today I speak to you as a specialist in family planning. I've published more than 250 studies and books in the field of contraception and family planning. As a specialist, I recognize that this bill represents a leap forward in our ability as a society to support women who want to control their fertility. Allowing women to have up to 12 months of their prescription contraception from a single visit to the pharmacist is vitally important for the health of the citizens of our state, while being cost-saving to the state, insurance companies, and society. Unlike other prescription medications, oral patch and vaginal ring contraceptives have a time-sensitive nature. If a man or woman misses a day or two of blood pressure medication or cholesterol-lowering medication, it's highly unlikely that any medical consequences will occur. However, for a woman using an oral patch or ring contraceptive, missing a few days can result in an unintended pregnancy. And it's this time-sensitive nature of these medications is what makes this bill so important. You might ask, what's the big deal for a woman to go to the pharmacy every 1 or 3 months to get her prescription renewed? The reality is that we all have busy lives. We all may be late in picking up these prescriptions and missing a few days. It's the time-sensitive nature of this medication or these medications that make us need to pay more attention to why this bill is really, really important. The state of California has actually studied this, and that's the reason why our managed care, Medi-Cal, and other family pack programs already require this provision. So we've studied this in our own state, and we know that the program, when it looked at pregnancy rates in women who received a 1-year supply as compared to a 1 or 3 month supply back in 2006, with a study that included 84,000 women who received birth control pills, that the pregnancy rate was reduced by 30%, and the abortion rate was nearly 1/2 lower in women who were allowed to get up to a 1-year supply as compared to a limitation of a 1 or 3 month supply. These types of findings from a research standpoint medically are just astounding. And for a time-sensitive treatment, providing a 12-month supply changes lives. It decreases unintended pregnancy rates and abortions substantially. These are your wives, your children, your friends. This is a life-altering change. And lastly, a word about safety. Providing a 12-month supply of a very safe medication will not put any patient at increased risk. The CDC doesn't recommend any follow-up for women who receive a prescription for an oral patch or vaginal ring contraceptive. The CDC selective practice recommendation states that no routine follow-up visit is required other than routine visits that the woman would otherwise have. So a woman who received 12 months of contraception is not at greater risk than a woman who receives a 1 or 3 month supply and then returns to get refills. There's no difference in health risk. In closing, hormonal contraception is safe, but the barriers that we provide for women attempting to avoid unintended pregnancy are unnecessary. Studies in California have proven that we are harming women and families and increasing healthcare costs for the state as well as for private insurers by limiting supply of these contraceptives for which proper use is very time sensitive. I know that the women of California and their families will benefit from this bill, and for these reasons I respectfully request your aye vote, and I'm happy to answer any questions you may have. Thank you.
Thank you, Doctor. Other witnesses, please.
I'm Deborah Rotenberg, legal counsel with Planned Parenthood, and I'm just here for technical questions.
Very good, thank you. We'll open it to others in support.
Catherine Austin Scott, representing the California Academy of Physician Assistants in support.
Very good, thank you. Good afternoon, please.
Good afternoon. Sarah Linder, representing National Association of Social Workers of California chapter, and we're in support.
Thank you.
Maya Ingram for the ACLU of California in support.
Thank you very much. Good afternoon.
Rebecca Griffin with NARAL Pro-Choice California, and we're proud to co-sponsor this bill and ask for your aye vote.
Thank you.
Good afternoon, Sylvia Castillo with California Family Health Council, also co-sponsors of this bill, and we respectfully request your aye support.
Thank you.
Chris Rosa on behalf of Bayer in support.
Very good, thank you. Anyone else in support? Those here in opposition, please come forward. And if you would like, if I could ask
I think they'll be sitting here. If one
to,
will.
yeah,
You'll have to get up to.
Doctor, if you could, if there are
You may
questions,
be-
we'll bring you back.
Yes, I'll bring you back if needed. Thank you.
Good afternoon.
Good afternoon. Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. Regrettably, we are here today in opposition. While we absolutely support adherence and understand the importance and the intent of the bill, we are concerned certainly about the potential for waste, or there's a couple specific provisions as well that we're kind of concerned about within the bill, that it would potentially have duplication of coverage. As you see, there are times when insurers or insureds can change from one plan to another. The question would be whether or not we would see multiple different dispensing requirements across those insurer lines. The other issue for us is the potential for waste. We're concerned that the bill doesn't specifically carve out a requirement that the individual try, at least for a 30-day or 90-day trial of a script before getting a 12-month prescription. Part of that is because with many medications, there could be unintended side effects or how someone relates to that medication. So we are concerned that you could then get a 12-month supply that would go unused. And so, I mean, those are kind of the practical concerns that we have with the bill. Like I said, we do appreciate the intent of the author and do support the concept of adherence, but we are concerned that this bill specifically also opens the door to why this type of prescription versus other prescriptions that we would see where someone would come in and say, we think we should dispense a 12-month requirement. So it sort of, it opens up that door to other medications, and for those reasons, we're regrettably here in opposition.
Thank you.
Good afternoon. I'm Jennifer Alley with the California Association of Health Plans, and I would like to echo the comments of my colleague here as well. And I just wanted to go ahead and clarify that Medi-Cal policy for Medi-Cal managed care plans is limited to sites where the 12-month supply is only for oral contraceptives and not for any other type of hormonal contraceptive. And it has to be on site at a clinic or and not at a pharmacy, and it must be billed by a qualified family planning provider. And so there's limitations on the Medi-Cal managed care population on where they can actually get the one-year prescription. And so we just want to be clear that it's not available blanket to Medi-Cal managed care enrollees at this time. Just wanted to clarify that. And we have concerns for the non-oral hormonal contraceptives. They have a 4-month shelf life, and yet they're not carved out of the bill. And so we found that information on one of the medication's user facts, and so that's how we found that. And so we have concerns about the efficiency of providing a year supply for a contraceptive that's required to be refrigerated. It only has a 4-month shelf life. Would we then have to provide additional year-long prescriptions? And so that is a significant concern for us.
Okay, very good. Thank you for that. Others in opposition?
Yeah, John Winger on behalf of America's Health Insurance Plans, also in opposition.
Very good, thank you. And I know that this is double referred to the Senate Committee on Health, so Dr. Hernandez will be addressing, I think, the health plan and health insurance implications of the bill if the bill moves out of this committee today. So, very good. Any other witnesses in opposition? Seeing no one, Senator Jackson.
Good afternoon. I'm kind of curious as to the response, both the medical response and the other response to the claims made by the health insurance companies, particularly the, duplication of coverage. I don't think people are anxious to go out and buy, take 2 sets of birth control pills at one time. So that one, I kind of get a sense we're not going to see too many people once they change coverage go out and get another 12 months of supply because they have a new insurance company. But the notion of the limits on the Medi-Cal aspect of this and then the hormonal shelf life issue, if someone could answer that for me, I'd appreciate it.
I will start that and then turn it over to our doctor, is perhaps the best one. In regards to the shelf life, requires refrigeration after 4 months, first of all. And I feel comfortable, and we feel that in other cases, like the family pack and things like that, patients have been fully capable of policing a product in the refrigerator because they often do so now with other medications. That's not that hard. And the shelf life is for up to 2 years. So I don't see how that's a real problem. A lot of people have to medicate whatever they're taking in prescriptions and things. In regards to the other issue, we've got, a lot of background on whether it's through family care or Medi-Cal or Medicare reimbursement, that they're able to use these products. There hasn't been a lot of waste being, I agree with you, people aren't going to, they're very cautious, women, on not doubling down on their birth control. As far as I know, there's not a big black market out there for sale of birth control products. And so this just, frankly, takes existing law and just says, instead of making someone go back every 30 days to the pharmacist or renew their prescription, just like other medications, 12 years. So we're using it in many other contexts. It seems to work well, but I'll let the doctor also answer.
I love your question because the reality is women are not stupid. Women.
Nice to know.
Yes, it is. It's this. I mean, in my opinion, opposition for that reason just implies that people want to do stupid things and that we need to control them. This is women who want to help prevent an unintended pregnancy. And they also are not going to stock up. And we have evidence from Oregon that rarely happens. Only 1% of the time, 1.2% of the time is there this stock up nature. So women who are trying something new will tend to only take a little bit and see how it works. And then the difference is they don't have to then go back to the physician, or if it works, they can go back to the pharmacy, get more. If I write a prescription for 12 months for anything right now without this law, a woman, that means I give her a 12-month prescription, but it's the insurance that restricts her from how much she can get. And so she can get 1 month at a time with some insurances, rarely 3 months at a time. But if I write for 12 months, she goes back every month and picks up a new pack. The difference with this would be if I write for 12 months, she can go and say, you know what, I'm starting this new, let me take 1 or 2. If I do well, I can go back and get 10, right? Or I can say, let me go back and pick up 6. That leaves it up to her to figure out what works best. But changes, it gives her some control over something that we're trying to provide control. It's a barrier, and we're trying to remove a barrier. And we know that removing barriers to when a woman's trying to prevent an unintended pregnancy is the most important thing we can do, for not only for her, but for her partner, her family, the couple that's involved. The shelf life, the senator already went over. There's a difference between requiring refrigeration, which is only necessary for the currently available contraceptive vaginal ring, not for oral or patch methods, if they're not going to use the method within 4 months. And there's a difference between refrigeration and shelf life. Shelf life is from the time that the woman picks it up or it's produced, how long is it good for? And that exceeds 2 years for most products. And then also keep in mind that you're writing a bill, or you're talking about a bill that not only is for now, but for the future. Currently, rings that are in development that are in the last phase of testing with the FDA don't require refrigeration. So you would hate to make some limit that's artificial and then have to readdress something that makes no medical sense, right? And so women are not dumb. If they have not enough room in their refrigerator, they won't take 12 months worth. They'll take 3, So I think this is, that's important. And then from a wastage standpoint, the biggest wastage is having a person not be able to achieve, prevent an unintended pregnancy. If any of you have ever had surgery or had something that was painful and you get a prescription for 30 days worth of pain medication and you may have only used 7 days, why did you get 30 days in the first place? Because the doctor, your provider wants to make sure you have enough there in case you need it. We have wastage of medications all the time because we're providing enough to make sure that you're taken care of. And wastage isn't the goal. When you've had surgery, the goal is to make sure that you have adequate pain control because it costs a lot more to the healthcare system for you to go back to the emergency room when you're in pain. The same thing here. It costs way more to the state, to the insurance companies if a woman has unintended pregnancy as compared to having a couple extra packs of birth control pills around.
Thank you. I appreciate that. And as a co-author, I was sort of begging the question because it sounds a little, frankly, condescending the way this opposition seems to present itself, and I hope in the future that the healthcare providers will recognize that they don't have to assume that women, or at least present the notion that women don't know how to take care of themselves.
One of the opponents had, I believe, mentioned that they don't provide coverage for all 3 options. It seems to me very cost-effective to give women the choice of oral contraceptives or a vaginal ring or a contraceptive patch, and that was one of the comments.
Can I also add, just so you're aware, because all of you may not be aware, they all are the same types of hormones, just delivered in different ways, either a patch or a ring or a pill, but they're the same hormones, same efficacy, same contraindications, pretty much the same types of medical issues related. There isn't one that you would say, well, in this circumstance, you can use a ring but not a pill. It's all the same. It's just a different delivery system.
Senator Wieckowski will be moving the bill at the appropriate time. Did you have a question?
No, I'm ready.
Okay. Senator Papley, would you like to close?
Yes, thank you very much. I wanted to thank my co-authors and long list of supporters, and as always, my office looks forward with talking to the opposition to see if we can come to common ground on some of these outstanding issues. Ask for your aye vote.
Very good. Thank you very much, Senator. Seeing no further comment, we have a motion by Senator Wieckowski. Please call the roll.
Motion is due pass the Senate Health. Hill?
Aye.
Hill, aye. Bates?
Not voting today.
Berryhill? Block?
Aye.
Block, aye. Galgiani? Galgiani, aye. Hernandez? Hernandez, aye. Jackson? Jackson, aye. Mendoza? Mendoza, aye. Wieckowski? Wieckowski, aye.
We have 7 ayes, and we'll hold the roll open. No? Senator Berryhill may be back, so we'll hold the roll open for the absent members. Thank you very much. Senator Morlock, I see you're here, and we have a short amount of time, so we may begin and then may have to. So this will be item number 10, SB 1253. Senator Morlock. We may have to take a break in the middle of this.
That's fine. I'll maybe even set a record here, maybe. Thank you. Thank you, Chairman Hill, and thank you, colleagues. As a certified public accountant, you want to inform your clients of what types of business entities that they can avail themselves of from a tax and accounting standpoint. You can be a sole proprietor, you can be a partnership, you can be a corporation. And in corporations, you can be a C corporation, an S corporation, or a limited liability company. All of these options have various reasons for their selection. They have their own advantages and disadvantages. The LLC option is provided in legislation for private investigators, for alarm company operators, and contractors. Unfortunately, realtors, real estate brokers, are not included to avail themselves of the LLC entities. So Senate Bill 1253 would allow licensed real estate brokers to avail themselves of using this opportunity. C Corps, provides salary and dividends. S Corps, salary and distributions. Partnerships, distributions based on ownership, just like an S corporation. But an LLC allows some flexibility on, shifting where the profits go based on reasons by the owners, maybe by commissions or other purposes in this case. LLCs are simpler and less expensive to establish, and they also give the option eventually, if you want, to transfer to an S Corp. This is an opportunity to show that California is business friendly. Many industries have successfully had legislation to allow them the LLC option, and Senate Bill 1253 would do so for real estate brokers, and it's supported by the California Association of Realtors, the Orange County Association of Realtors, the California Business Properties Association, and I have witnesses and from those organizations, and respectfully
Very good, thank
request
you.
your
Would
support.
you like witnesses in support, or whoever? Please.
My name is Allison Harris. Can you hear me? I'm a real estate attorney, and I'm here on behalf of NAIOP, which is a commercial real estate development association. And this would merely update the Business and Professions Code to allow brokers to use LLCs in addition to corporations. It makes sense. I've looked through the bill. It's very straightforward. Everywhere where they have an ability to use a corporation, they would now have the option of also using a limited liability company.
Okay, thank you. Others in support?
Mr. Chair and members, Matthew Harg with the California Business Properties Association. We are the sponsor of the bill, and we urge your aye vote. Thank you.
Thank you.
Mr. Chairman, I'm Stan Wigg with the California Association of Realtors. We also support the bill. I would emphasize that the liability that's being dealt with here is not one of a tort liability, but rather of tax liability. Mr. Morlock is much more competent than I to tell you about the different considerations that go into it. But we have lots of corporate licensees now within the Department of Real Estate. Your analysis raises the issue, would this change the workload of Bureau of Real Estate? Probably not, because it's something of a zero-sum game. The folks who are forced to be corporations now but can't be an LLC, if they wanted to shift over to being an LLC, they would become an LLC. So I don't think that there's going to be a significant increase in workload. Also, your analysis very thoughtfully points out that there's a great deal of concern about money laundering and people concealing the ownership of properties now. The Bureau of Real Estate doesn't review property ownership. They review the ownership of companies. They review the broker who's in charge of the company, the designated officer, and they do a background check on them, whether they're a corporate officer or an individual practicing as a principal. And so the background checks we think would be the same, so we don't think there's a chance there of misconduct. Money laundering is typically a way to change cash into a financial instrument. And your analysis raises the question, well, would there be cash transactions that we would lose sight of the control of? We don't think so, because the quote, all cash transaction, in the context of your analysis, all cash means something that didn't have a loan. But the money laundering statutes are really directed at getting a hold of cash before it gets into the financial system. And in that case, it really doesn't matter, because it's already in the financial system, whether it's a no loan or a financed transaction. So I think that the concern raised in your analysis is one of theory rather than actual practice. So I would suggest that that's really not a problem here as well. Again, we urge your aye vote for the bill.
Thank you. Others in support? Is there anyone here in opposition? Seeing no one, a few questions, if I could, Senator Morlock. There were similar bills introduced in 2004, 2006, and neither one of them were passed out of the Judiciary Committee. And a lot of the questions then they did have certain liability insurance requirements. I mean, this committee is really, its function is to protect the consumer. I mean, that's what we're looking for. And this bill has no protection really in terms of liability or some way that the consumer would be or could be protected in some point in time. So you see, and why is this, how do you expect a different result this time than last?
think
Even
that's
though
a-
that wasn't, you were a different author, I know.
No, it's a great question, Mr. Chair. Currently, real estate brokers are already insured and required, I think, to do with their license, but also the reason that the other two bills did not pass, from my understanding, is that the negotiations for mandatory liability insurance got to be a little dicey and just didn't make sense. And maybe my witnesses can provide a little
Mr. Chairman,
more.
if I might?
Of course, thank you.
California Association of Realtors was a sponsor of at least two of the earlier bills. As the senator points out, at that time, the LLC was a new creature. We weren't sure what it was going to do. And my friends at the consumer attorneys, the trial lawyers then, but the consumer attorneys now, had suggested that we needed to have very substantial E&O policies in effect for those LLCs. Many of my members now do have E&O policy, but it's not mandatory. We contribute something like 12, as you'll recall from the hearing a couple of weeks ago, contribute something like 12% of the license fees into client recovery funds within the Department of Real Estate, which backfill any losses that are suffered by consumers from fraud. And then in addition to that, most of the corporate kinds of licensees will have general liability policies as well. So we don't think that's necessary to build into the structure. The corporate license now does not require any kind of errors and omissions coverage, any kind of malpractice coverage. The LLC is really a subspecies of the corporate license, and we don't think it should either.
Okay, other questions? Any questions? Seems to be the issue, if you could go over again the federal government's issues and the transparency issue of how this could be different from a corporate standpoint. If it's a corporation that is owning the or own, the firm, and an LLC, does the LLC provide a better or an easier ability to shelter, to avoid, or to kind of avoid the transparency that could be identified in other ownership tools?
Well, a C corporation is designed to give you a salary, and sometimes you'll do dividends, but that's a double taxation. So a lot of small businesses won't issue dividends. They'll just
It'll be an S corporation.
In an S corporation, if you don't have all the profits distributed through salary, then you're going to get a K-1, which says, here's your share of the taxable income, and that's distributed by ownership interest. So it all gets split out based on, the factors that you have in ownership. But with an LLC, you could deviate. You could say, okay, partner A, you did not work most of this year because you were ill. Why would you receive half of the income or whatever percentage you own? So they give some flexibility to the ownership to say, okay, we're going to give the income where it was derived and move it over, which you can't do with a partnership or an S corp. So it gives you flexibility. I don't think that's sheltering. I think it's an ability to adjust to real life factors.
Okay, well, it's really the purview of this committee is to see if it's a tool that could be used and that it would work within the system in Department of Consumer Affairs and within the Bureau. And I think that this does provide that opportunity. But I think the issue of liability will be something that will be taken up in the Judiciary Committee, and I respect the chair to be looking at that carefully.
He's a wonderful chair. It should be a fun time.
He's a great vice chair, too.
Very good. Any questions? Yes.
Move the bill, Mr. Chair.
Thank you very much. Senator Mendoza, we do have a motion. This would be to pass to Judiciary Committee. Please call the roll.
Hill.
Aye.
Hill, I. Bates. Aye. Bates, I. Berryhill. Aye. Berryhill, I. Block. Aye. Block, I. Galgiani. Galgiani, I. Hernandez. Aye. Hernandez, I. Jackson. Mendoza.
Aye.
Mendoza, I. Wadkowski.
No.
Wadkowski, no.
I'll see you in Judiciary.
All right. Thanks, Bob. Thank you, Mr. Chair. I think we can get to session, and we did it. Thank you.
7-1, that bill is out, and we'll see you. Thank you very much. We will recess now until the conclusion of session. We have two more bills.
Jerry, can we leave our stuff here?
Yes. We will reconvene the Business and Professions and Economic Development Committee hearing for Monday, April 4th, and we will take item number 6, SB 1155. Senator Morrell, welcome.
Thank you.
Thank you. All right. Please proceed when you're ready.